Hi, welcome everybody. It's me, Dr. Khaled Sadek, and I'm welcoming you to my channel on cysts and lipoma removal. Today what I'm going to do is a live chat with everyone about, first of all, what we offer in clinic, explaining a little bit about lipomas and cysts, before going on to talk about the comments and answer everybody's questions that we have online. I want to first begin by describing what we do for those who aren't familiar with our channel. I'm Dr. Khaled Sadek. I'm a physician based in London, in the United Kingdom, and I specialize in the treatment of cysts and lipomas. I want to first talk about lipomas, what they are, how we treat them, and where they come from. So let's first begin by defining what a lipoma is. Now, lipoma is a benign fatty tumor. Now, you might get a little bit panicky when we use the word tumor, but actually it's benign, so it's a relatively safe form of growth compared to what you might have heard as like a malignancy. Now, these tumors can vary in size and location, but they typically start very, very small before growing with time, and they can reach up to 5 to 10 centimeters in size. They can occur in any part of the body, and they affect men and women equally. However, typically the average age of a lipoma presentation is around the 30s, and then they proceed further on. Men have a tendency to develop multiple lipomas, while in women you tend to see single one lipomas. As a general rule, the lipomas tend to be very, very superficial, lying just beneath the skin. And if you touch it, they feel like a soft egg. They're very mobile, they're not tender, and they don't tend to have a huge amount of blood supply. There are various types of lipomas, and the basic form is just a plain bog standard lipoma. You can then develop an angiolipoma, and that's a lipoma with blood, and you may feel a throbbing sensation in that as well. And at the other end of the spectrum, you can get liposarcomas, which are malignant, dangerous forms of lipoma and tumors. So, what do we do with lipomas? Well, typically, you don't necessarily have to do anything at all. You could just leave it there if you want. However, they can be very uncomfortable, very painful, and so some people do wish to have them removed, especially if they're in a location which isn't particularly pleasant. And so the first thing I'd recommend is maybe doing an ultrasound or an MRI just to determine the size and location of the lipoma before we go ahead and remove it. What causes them? There isn't any specific cause for a lipoma. It's not diet related. There isn't any firm genetic causes for the large majority of lipomas. There is a tendency to have familial traits. That is to say that, some people tell me I've got lots of lipomas, and I remember my grandfather had lipomas as well, and therefore I'm developing these as well. I also get a lot of patients who've had trauma, people who have fallen, bumped their head, and they've gone and developed this growth of a lipoma. The trauma itself doesn't necessarily cause the lipoma, but if there is a fine lipoma underneath there, then that can accelerate the growth. And also I get to see that a lot of women and handbags on their shoulder as well. So, what do we do with lipomas? Well, the most common solution is to have them removed with local anesthetic. And if you look at my videos, you'll be able to see exactly how I go about doing that. The most common cause is a little bit of local anesthetic before making a small incision, and the lipoma tends to just pop out. Now, the lipoma itself is encapsulated in a fibrous tissue, which makes it very easy to remove. It just kind of pops out. However, there are lipomas that are much larger in size, and they can also be associated with finer, smaller lipomas as well, lipomatas, as you may have heard. These tend to be a little bit more tricky to treat and also have a higher incidence of reoccurrence, which you don't want. Some surgeons also offer liposuction with variable success, and there's also an injection, which may also help in that respect. So, in summary, lipomas are common, they tend to be benign, they can be removed through a local anesthetic procedure, and they tend to not come back once they're removed. But they can if it's not removed out whole. So, with that said, let's take some questions from the audience. Let's first begin by welcoming everybody. It's always great to have so many viewers from all over the world, from Jersey, I can see there, Grenville, California, everyone from around the world listening in. The other forms of skin, and Australia as well, Tasmania, the other forms of skin pathologies that we deal with in clinic are cysts. And these are typically sebaceous cysts or epidermoid cysts or pilocysts. Now, there are different cyst names, and people think why they have all these various names, and it's because of the cell type that composes the sac of the cell. The embryological origin of that cell type will define the name of the cyst. So the most common form are sebaceous cysts. They're sort of oily glands under the skin. They become blocked, but they continue to produce this sebum, this keratin, and they grow and they grow and they grow. You know, by themselves, very benign again, but they are very rich in energy and therefore a wonderful source for bacteria to go and inhabit. So they can become infected and they can become very, very painful and tender. And so my advice is to have them removed earlier rather than later. But if they do become infected, we can treat them as well. We can make what's known as an I&D, which stands for incision and drainage. And that involves making an incision into the skin and then removing the content before placing a special kind of antibiotic ribbon into the sac and letting that heal. When you typically make an incision in the skin heals through what's known as primary intention. That means the skin heals from the top going down. It's a much quicker way of healing. And it also allows us to place stitches in the skin as opposed to leaving the wound open. However, when something is infected, you're unable to allow that kind of healing, and you need to allow something called secondary healing. And therefore, what happens is the wound heals from the base up, a much longer process. And to prevent any encapsulation of any bacteria, we have to place the ribbon into the sac so that allows the ground to rise up to the surface. Again, you can look at my videos online and you can sort of get a picture of how we do that. The procedure involved is very much under local anesthetic. And again, if you remove the sac, it shouldn't really come back. I like to give the analogy of the balloon, and I've said that in a previous video before, and that is if you get a balloon and you blow it up and then you fill it up with shaving foam, that is basically what you would have, for instance, a sac full of sebum. Now, in itself, not infected, but you can feel that it's big and it's juicy, you can press it. What happens when the bacteria get inside is that sac just bursts and all the gun just goes everywhere. The skin becomes inflamed, red, angry, and cellulitic. It's a real challenge to then go back and pick up all the little bits of rubber, because if you leave a little bit behind, some of that sac will then regrow, and that will cause problems later on. So I think that's been a wonderful introduction to what I do. So with no further delay, let's take some questions from the floor. Let's start by welcoming everybody. Thank you for all joining in. I've tried to get a good time for all of our viewers. We've set it for 7 p.m. Eastern time. So let's start. Let's say hello to everybody. So I love your videos. That's Marianne Karimi. We've got Rusty Ann. Hello from Phoenix, from Rubin. Who else is down there? So love your videos. Hello from the States. And Rusty has made it. So we've also released a different style of video recently, and that's the commenting on the comments, which I think went pretty well, and it's something I might look into doing a bit more as well. But let me know your thoughts. There's also talk of diversifying, the talk about different products, maybe talking about general health, not just necessarily the skin, but again, more suggestions from wherever you are watching. So let me ask you all a question. Can you please tell me what time it is and where you're calling from? Let's take up some questions from the floor. So Indiana, New York, and Diane. Hello everybody, welcome, welcome. Let's get comfortable. Okay. New York here, fantastic, love your work. Washington, it's 6:45 in Florida. New York, 6:15. Boston, so it's around 6, 7 Eastern, sort of mid time. And everybody from the States. Do we have any people from outside the States? I see Kentucky, New York, Florida, Cracker Jacks, Marianne. Who else do we have there? Trouble, Pamela, Caroline Jenkins, welcome. Wales, 1864 always. Philadelphia and Santa Monica, fantastic. We've got Howdy Deborah from Bloomsfield, Alabama, Wales in the United Kingdom, Chicago 517. So this is fantastic. We have a real global audience tonight. Dallas is 520, Deborah Woodward, and Ohio 617. So what I'd like to also discuss with you is what you want to see. We get a lot of requests for blackheads, these pores, these Weiner pores. We get a lot of requests for sebaceous cysts, pilus cysts, epidermoid cysts, lipomas. You tell me what you would like to see and we'll try and post more of that online for you. What else have we got here? We've got, skincare advice, please, from Full Bloom, Illinois, Southern Illinois, fantastic, brilliant. Tallahassee, Ringo's, New Jersey, blackheads, the good ones. Okay, fantastic. We also were thinking of doing a live operation. So we will think about how we might find the right candidate for that and also the timing as well, because that's always quite exciting to see. I'm also playing around with the YouTube stories. So I don't know if you've noticed that, but we're doing a lot of YouTube stories, trying to give you daily updates as well, keep you updated. So that's a great way of finding information about the site and how we're going to be doing that as well. So examples of skincare products, expensive skincare products. Well, okay. So a lot of people interested in the skincare itself. What is this? Love Live, great. Hello, my man from Anastasia. Alaska here, fantastic. Must be very cold in Alaska. What else is going on there? More cysts. Find pleasantly entertaining. I find you pleasantly entertaining. Well, that's good. The cysts, okay, mucosal neuromas, okay. Ask questions earlier regarding growth on my forehead, not mobile. Okay, well, that's my Taomi. She's worried about a growth on her head. It can be a number of things. Pilus cyst is the most common, especially if it's in the scalp, in the hairline. If it's in the forehead or the nape of the neck, then you're looking at a lipoma. But of course, do see your regular doctor for advice about that. Don't just take my word over the internet. You have to go see a physician in whatever jurisdiction you're in. There are lots of videos online with pilus cysts, typically associated with hair loss because the skin's overstretched and inflamed and it causes the hair to disappear. A lot of people discussing whether or not we should have audio or not audio in our videos. Let me know your thoughts. People wanting us to have a microphone. So we rigged up a microphone today. See, a microphone. So we kind of really geared up to this whole vlogging industry. So let me know what you think. Audio, Trouble thinks we should have audio. Hit the like button, guys. Yes, that's we can't do this without everyone's support. And also don't forget, if you do press the like button, don't forget to press the alerts button, the bell button as well, because then you'll know when the videos are going live as well. Slight hiatus in recording at the moment because we're renovating some of the apparatus, but we'll get more of that up and running soon. A lot of questions about the technique we use, flushing, sutures, the size of the needles, what kind of ribbon we use, how we separate the skin. I prefer watching you over Dr. Lee now. You show more procedures and offer great explanations. That's really kind. How many people out there prefer watching me to Dr. Lee? I'd really like to know that. What else is there? Greetings from Texas, boils or cysts. Enjoy your videos, teaching as you explain what you're doing. Dr. Lee, Hollywood, Denver. Okay. I love you and Dr. Lee. I think that's fair. We got to give respect the godmother of the pimple world. The technique we use is a local anesthetic technique. So it's a 2% xylocaine. So we have a lidocaine and adrenaline, so it works very, very quickly. We put it into the skin. We make a small incision. As you can see, I typically use a very, very small incision. And then we take out the contents, whether that be a sac or a cyst. With the cysts, we don't tend to wash out. A lot of people are asking, do we wash out? Do we wash out? We don't tend to do the peroxide washes here in the United Kingdom. If it needs maybe some saline irrigation, but a good swab out and some curetting is more than sufficient for that. So we don't tend to do the swabs, washouts at all. The next thing we would do is, once the sac is removed, we'd probably put in some suture material, some stitches, and I use a 3/0 Vicryl typically, and I place that subcuticular so it runs underneath the skin. At least audio is so important for me. I like to hear what you and the patients are chatting about. I'm not a fan of videos without audio. Well, yeah. We did have this one lady who wanted to listen to the opera at the same time. So I had to take the audio out because I wasn't sure about how that would work with copyright infringement and YouTube house rules. So I love watching either. Okay, I prefer your channel to hers. Where's the cyst? Yes, I agree. Your personality is what I like. Okay, Dr. Lee is still awesome. I hate Dr. Lee for growing and moving on. Oh, come on, she hasn't moved on. She still loves everybody. My love for pimple popping videos, and I miss her. What's your favorite thing to pop? Dr. Lee is good, no doubt, but I enjoy the videos much more, and I think your conversation with your patients are much better. Okay, well, that's some really, really beautiful feedback from everybody from all around the world. So we certainly will be focusing on the procedure, but also the chat as well. So we're going to invest in some more microphones, some better camera equipment. We're going to try and get the team a bit better around the whole the filming section of the videos. So we're hearing your feedbacks, and we are obviously still in our infancy. We've only been going for about 3 months, I think, on YouTube, and we've had some wonderful success because everyone has supported us so very, very much. I think over the last month we had 17,000 subscribers, 2 million views, really, really great numbers. So we couldn't do that without your support. And I think it's so important that we thank you by doing these live chats, taking your calls, your questions, replying as much as we can. So thank you. So what else is there? I understand you have a situation you can't... What was that one? I didn't... What was that? I understand you have a situation you can't include sound. I love watching... Yeah, absolutely, yeah. Okay. I love watching blackheads. Thank you. Well, I love the wave. Yeah, the wave is fantastic. Can you get close-up videos? Yeah, we can do. We're going to try and get a bit more close-up on the operations. I think it's a case of sort of getting my hands in the way because we kind of can cover up the procedure as well as being able to get a close-up on the video. So I think the cameraman will do a bit more work. Do we have a nurse? Yes, we do have a nurse. Sometimes use her, sometimes we don't. In the more complicated procedures we do. You probably don't notice her because she's so good at being invisible. Also, I thought I'd show you the kind of equipment we have. So this is a bronze kit. It's not the one I use. I use a silver pack. But inside, I don't know if you can see, but it's got all the kind of equipment stuff that we might use, including the drapes, the forceps arteries, the dissecting force scissors, straight scissors, and curved Mayo scissors as well. So let's have a look at those questions. Let's try and catch up on questions. Def, our chair on top of great videos. How long have you been a doctor? I've been a doctor since, probably 20 years, I think. Being a doctor first and YouTube star second. Yeah, okay. Don't think I'm a YouTube star quite yet. Can't believe you get paid for what I would love to do for free. Yeah, I mean, we don't get paid very much, to be honest with you, but yeah, we love doing it as well. Where did I go to school? I went to school at St. George's Hospital Medical School here in London. It's where I undertook most of my training. And I traveled all over the United Kingdom as part of our residency program. What's going on here? Come to Australia and operate on my strange mucosal neuroma cysts. I would love to. I'd love to come down to Australia. Alternatively, you could come and see me in London. Might be a little bit quicker. Hi from Philly. What else is there? What is the best treatment for teen breakouts on the shoulder and chest? Yeah, I think with teens and multiple areas, depending on the severity, you're probably looking at something a bit more systemic. So maybe like an antibiotic, like a lipocycline. What else is there? Have you been to the United States? I love the United States. I think I've been to a lot of different states. I've been to New York, Boston, Miami, and California, and San Francisco, and Los Angeles, and Hollywood. I've been all over the States. Absolutely love it. Love to go back again. You know, if I could link up with Dr. Lee, do some sort of collaboration, that would be phenomenal. That'd be great. You must be a Doogie Howser if you've been practicing for 20 years. It's kind of an American reference, not quite getting it over in the United Kingdom, but do please explain, Boo Boo Kitty. North Wales, United Kingdom. I'd like to see the injections, but love to see the rest. I don't like to see the injections. Okay, so yes, a lot of people saying, please don't waste your time with the videos of the cleaning and the injection. But actually, I think you gotta enjoy all of it. You just can't go for the cyst. You have to take the whole thing, I'm afraid. You should read this bio, very impressive. Okay, you should read his bio. Oh, thank you very much. Hello, Dr. Khaled from Holland. Hello, Linda. Is it from Amsterdam or where in Holland are you? Did you ever come to Liverpool during your residency? Yes, I did go to Liverpool. Can't remember which hospital it was, but I was in Liverpool in around 2010. So there's some Mexico. Welcome, Mexico. Do you ever check in with or check former patients? Yeah, of course, we check with our patients week after surgery, longer if need be. We follow them up as and when they want us. Door is always open for patients to come back in. They often have my personal number to contact me whenever they want. So yeah, aftercare is really important for what I do as well. Let's see what else we got here. You come to Australia, you could teach our doctors a lot. I think your doctors already know a lot. I love watching your work from Idaho. I love the start of your videos. Yeah, so we've introduced this new introduction to make it a little bit more professional. Let me know what you think about that, the introduction. I quite like it. But yeah, it's all about kind of retention and giving the viewers what they want, giving YouTube what it wants as well, so that we can increase our algorithm and how that presents as well. Let's put this camera down a bit. It's a bit high, I think. There we go. What else? New Orleans. Lipocycline helps a lot. I'm on lipocycline. Fantastic. Yes, you and Dr. Lee. I'd love to meet you. You're welcome to come to America anytime. That's too kind. Hi, Doctor. Love your videos. Watch all the time. Why, thank you, Connie. I do love all of the procedures. Patients panic. You know, the women are very stoic, actually. They're very, very good. They do have a good pain tolerance. The men, absolute wusses. What else is there? Doogie has a TV character who was so smart. He was a doctor at 14. I was not a doctor at 14, and I'm not so smart to be a doctor at 14. So I don't think the Doogie Howser analogy works with me, unfortunately. So Doogie Howser was a 12-year-old TV doctor. Okay. Have you ever done Doctors Without Borders, like a Médecins Sans Frontières? I haven't because I never really had the time to be able to commit for a 6-month deployment. I'd love to be able to do that. I'd definitely love to look into that. Absolutely. Let me see what other comments are there. I like the whole thing, see what you do and explain. Yeah, I like that too. I think it's really important to be able to run through it, because a lot of my patients, they will see the videos as well. New patients will get the confidence and being able to run through the procedure. A lot of people have a fear of doctors, so part of the process to reduce the phobia about coming to the doctors and getting the confidence to come in and see what we do. First of all, online, come into clinic. We're real people. We're happy to help, and that's really the gist of what we do. So I like the whole thing. What else is going on down here? So Doogie Howser. Okay, I get the Doogie Howser, guys. Stop telling me about Doogie Howser. I never get to London, so you're famous around the sites. Yeah, I will keep showing those site locations. You absolutely love them. Just need to think about more locations. So if you want to see anything in particular, let me know. I'm happy to oblige. I always read everybody's comments. I'm from California, so I totally agree about the pain injections. Don't need to see them. Actually, the procedures and what we're interested in. Yeah, I know, but come on, you got to have a bit of rougher than smooth. I've always assumed that you're a dermatologist, but I guess technically you could be a plastic surgeon, a general physician. Can you clarify? I trained in OBGYN before moving to GP. So my special interest is in surgical procedures. I think I agree that wave has got to stay. Yeah, I love the wave. I love the wave. The other day we had a premiere on a video clip, and what I've realized is we could do a global Mexican wave. So like I start waving, and then everybody from around the world should wave and put their location. I don't know if we can do that, but let's try and do that. Let's do the wave. So put the wave on the emojis, and then put your location, and let's see if we can get this global Mexican wave going around the world. Let's see if we can start that. I want to see steatocytomas, if you have some. Yeah, steatocytomas we do. They tend to be in the private parts, so it's not something we can typically film, but we do get a lot of them coming through. What else is there? You've got great London Eye would be good. I do a film on the London Eye. That'd be good. Yeah, Dr. Vaughan went to LA to see Dr. Lee office, and he met her brother after setting up a meeting. Okay. I'd love your bedside manner. Dr. Lee would love to collaborate, I'm sure. Don't know how I'd reach Dr. Lee. It'd be fantastic if you collaborate with Dr. Lee. There's a lot of Dr. Lee. Mania in the house. There's Christiana. We love watching your videos. How long does it take to assist to heal after the operation? I saw someone had it left with a hole in their leg after the removal. Well, you know, lipomas, cysts, if they're not infected, they will heal very, very quickly. But if they are infected, do expect several weeks, especially with the packing with the Aquacell AG. I totally agree about the pain injections, right. How are we doing with the Mexican wave? Let's have a look. So, where are we? So, Linda's kicked it all off. Thank you. I didn't know you started an OBGYN. I did. I started an OBGYN. Southampton. Hello, Southampton. Laura Knowles. So, yeah, I did part of my residency program in Southampton at the Princess Anne, I think Princess Anne Hospital. Is that the maternity unit? Southampton General. So what else is there? Massachusetts, Florida, Louisiana, Trouble, Scotland. Yes, it's a fantastic idea. Let's have a look. So Washington State, Ohio, Tallahassee. Does National Health pick up the cost? Please explain. Yeah, we pay taxes and it pays for everything. Texas, Cardiff, California, Indiana, Ohio, Aberdeen, Stonehenge, United Kingdom. Yvonne, where are you calling from? Maine, USA, London, Ireland, North Carolina, Saddleworth, United Kingdom, and more and more and more and more ways. You know what? I think we've definitely gone around the globe with our Mexican wave. It's been fantastic. I love it. Guys, it's just endless. Liverpool, Australia, Belgrade, Arizona. You know, it goes on and on and on. So, awesome. Love to know about freezing eggs. I know this isn't the forum for that. Yeah, I mean, egg freezing, it is increasingly popular because, you know, women are having children much later on in life because of work, social structures. There's lots of different reasons why women are having children much later on in life. But what you've got to remember is that the woman is born with a fixed number of eggs, something in the region of about 400,000. And when they reach the age of menarche, when they start to menstruate, several thousands of these eggs are recruited every cycle. One of them will ovulate and the rest of them will perish. So you have a diminishing reserve over the many, many years. And so by the age of 30, 35, your egg count is depreciating, the quality of eggs is depreciating. And so we do recommend to sort of get childbirth under the age of 35 because your ovarian reserve does drop quite rapidly, so the chances of delivering diminishes a lot. Now, to counteract this, a lot of clinics are offering egg freezing as a way of preserving fertility. Now, the most common process is they retrieve the eggs from the ovary and they just bung them in some liquid nitrogen and they keep them in cryotherapy for some period of time. More recently, what they've offered to do is ovarian resection. So under general anesthetic, laparoscopic keyhole surgery, you'd undergo a resection. So like they would snip a wedge of the ovaries, they'd freeze it, and then when the time comes for you to have the eggs, they'd put them back in, defrost it, and then that ovarian tissue would release the eggs. And it's supposed to produce a better response than if you were to just freeze the eggs alone. Obviously, you can freeze embryos, which has much, much greater success than just freezing the eggs themselves. Okay, so what else? Let's have a look. What else is in the questions? Let's go. Canada, fantastic. Georgia, Espanol, better hours in dermatology and OB&G. Yeah, you're absolutely right. There's a big burnout in OB/GYN. Not good, not good, but peace out to all my OB/GYN fellows out there. That's awesome. I'd love to know what you think about freezing. So that's where we got to. Where are we now? Georgia, Cheryl from Minnesota, Dr. Lee, and me. Love you both. Fantastic. New Mexico, you have a unique way of closing the wounds and sewing. Yeah, so I do a surgical knot with my fingers. I don't like instrumental because it's very childish. A real surgeon throws his knots. What else is there? This is so nice. You can really chat and wave. Yep, that's right. Okay, Oregon, I think it's important to show us all the stitching. Yeah, okay, so maybe I will run, maybe I'll get a piece of chicken and then I'll just show the stitching for everybody because that seems to be a really popular question from everybody. What else do we have here? Let's have a look. What else is there? Let's have a look. I didn't know about the eggs. Great conversation. Yeah, so maybe we could diversify to cover different aspects of health. That'd be a good idea as well. Manchester, hello. Linda, hi. Rusty, hi. The elder sister had a baby at 45, no problem. Fantastic, great eggs. Have you ever heard of tumor cells? Yeah. Do you speak French? No, no French, unfortunately. I love your channel. Is there a Mrs. Doc? Will you bring her on at some point? Watch this space. I love your stitching, small incision. Some people have great fear of scars. Yeah, I just got to, it's all about the scar because when the patients go home, that's what they look at. They look at the scar and that's what they show everybody else. They don't really know what goes underneath the scar. Why did I switch from OB/GYN? It was just because I just felt I could do better in other fields. Princess Anne's a lovely hospital. Yes, it is a lovely hospital. Okay, let's have a look. Wow, I didn't know certain eggs, more about the eggs. Never knew about the eggs. And no, I think they meant subculture versus mattresses. Oh, I see, yeah, the stitches, yeah. Jodie Fuller, do you have an assistant or do you operate solo? I often operate solo, but sometimes I do have an assistant if it's really complicated. The scalp surgeries, which I don't think we film a huge amount of them, but like, scalp lipomas in particular, they can bleed a tremendous amount. So we do have a team on hand for that. So, right, I just want to thank everybody for watching today. I hope you've enjoyed our discussion. Remember to continue watching, subscribing, supporting, sharing. Press the alert button if you're already subscribed. That will let you know when new material is being released. We're back in theatre this week. We're going to be filming some great material. We're going to do another comments on the comments. We might even do a commenting on the live video, which we haven't released. So we'll have half a screen of discussion, half a screen of operating. So we can kind of like make a montage and see how that goes. Let's take some last few questions before we all wrap up, because you guys want to be going home. My husband would like to know what your nationality is. I am British. Loved it. Thank you for your time with us. Absolute pleasure, Patricia. Night, night, Caroline Jenkins. Bye-bye, everyone. Okay, till next time, everybody. Enjoy. Take care. Bye-bye.